In theory, but you could still make amazing breast milk just by having McDonald's every day.
What? Hi, welcome to PWRMUMS PODCAST. Today we're joined by Dr Mythili Pandi, who, amongst other things, is a mum and a doctor and a lactation consultant. And welcome to the podcast.
Thank you, Catherine.
Would you mind introducing a little bit more about yourself?
Sure. So my name is Mythili. I am a family physician at the International Medical Clinic at the East Coast. I'm also a lactation consultant, so I'm an IBCLC. I'm a mum. I'm a mum to 3 beautiful young children. They're 10, 8, and 6 years old.
Who we might hear in the background.
Yes, you will, for sure.
And so we've had a few talks with people, and it's been mentioned, lactation consultant has been mentioned, but what is a lactation consultant, for those that don't know?
So a lactation consultant is a person, a woman or a man, who is an advocate for breastfeeding. Okay. So this person, this LC, would be able to help mothers in their breastfeeding journeys. And breastfeeding journeys take all sorts of routes, really. Some mothers choose to exclusively latch their babies onto their breasts, and therein comes problems with latching and cracked nipples and babies just refusing anything else but the breast. And it could also take the form of exclusively pumping and expressing breast milk and feeding the baby using another means besides the breast. So a lactation consultant comes in to help mothers in their breastfeeding journeys, and that's just an all-encompassing way to put it, really.
Fab. And can anybody, could I call myself a lactation consultant?
Well, to be an international board certified lactation consultant,
it's a mouthful.
Yeah, IBCLC. It takes at least 5 years of training.
Wow.
So there are different routes that you can take, different pathways. You could start off being a doctor or a nurse, and that gives you additional hours because of your medical training. Okay. Or you could be a mum, just a mother who is passionate about breastfeeding, and then they could take different routes by being a peer counselor or by tagging on to an existing IBCLC. And doing it that way.
So if you've got somebody that's calling themselves a lactation consultant and they've got the international board certification, you know that they are very experienced, very quality. Because that's a dedication then.
Yes, yeah. Absolutely. So there are heaps of people out there who call themselves lactation consultants but are not IBCLCs. And of course there are some who are pretty good and they do dish out some good advice, but there are also some who might be a bit quirky, maybe.
Yeah, have their own ideas that aren't necessarily okay. So good to know that someone's got that board certification.
Absolutely.
And how long have you been doing that for?
I've been working in the breastfeeding scene since my first one was born, so for 10 years. And I've been an IBCLC for the last 2 years now.
Wow. Okay. So pretty much, not that 3 years into being a mum, you started becoming a lactation consultant.
That's right. Yeah. So I started with the training. I started with the paperwork, and it's pretty hard work. I'd say a lot of long nights outside of breastfeeding.
Yeah.
Yes.
And so, do you find a lot of people with your being a GP as well?
Yes.
Is that something that people would quite like to? The fact that you're a GP and a lactation consultant, it marries two things together that people have a lot of confidence in you. People might seek you out because of that, do you find?
Yeah, so what I often find is I find that I get a lot more of the more challenging problems.
Yeah.
So, and I love it. I love a challenge anyway. But so what I can do is then I can diagnose and I can treat the conditions if they do come in with a medical problem. And I can also give drugs. So, I mean, it sounds worse than it is. I can give medication rather than drugs. But yeah, so I can actually help mothers along with their breastfeeding journeys in a different fashion compared to another IBCLC.
Yeah, okay. And so you've mentioned that you get some of the more challenging cases.
Yes.
What's been your most challenging case that you can share?
Recurrent milk ducts, milk blisters, and abscess. Some of them have gotten pretty nasty, but I've had mothers with abscesses where, it's just an open wound, but they're still dedicated to breastfeeding and they're still feeding their babies on these breasts, and that's amazing. So
talk to me about breast abscesses.
Oh no, maybe we shouldn't.
No?
It's not pretty, but it's when mastitis gets...
PWRMUMS isn't pretty.
Okay, I hear you. So it's when mastitis gets so bad that there is an encapsulated infection in the breast.
Okay.
Right, so what then the breast surgeon would have to do is to make an incision, drain it, and sometimes leave it open so that they can get all of the infection out of that breast. And that's where it doesn't get very pretty. So it's just packed with gauze and allow it to heal by intention.
Oh, wow.
Yes.
So that's why you shouldn't ignore blocked ducts.
Absolutely.
Okay, so blocked ducts, what's a blocked duct?
What's a blocked duct? So ducts get blocked for several reasons, and the most common reason is when the milk just stays. It just stays in the duct without getting it cleared. Okay. That comes with many different reasons. If your baby's not suckling adequately, if the baby's not latching onto the breast well, or if the mom just goes on without removing milk from that duct, there's a potential for it to become a blocked duct. And so blocked ducts, then if there's an infection that sets upon it, then it gets to mastitis.
Okay.
And then if the mastitis is not treated for many, many days, there's a potential for it becoming an abscess.
Right, so it's a cascade of nasty.
Slippery slope.
Slippery slope.
Very slippery slope.
And so most of your mums that come to you with, say, blocked duct, would they be new mums, new in their breastfeeding journey, or could they be mums who have got an 8-month-old, like myself a few weeks ago, that had a blocked duct? Where would most mums
Anytime,
fall, really?
Most of the time, it tends to be when mothers have issues with breastfeeding. And you know what? Sometimes I get moms who carry a backpack with their heavy laptops in, right? Because they're going back to work, right? And because that duct is then not cleared for very long, or there is some kind of, we call it trauma to the breast because of the heavy backpack.
So the backpack being here,
yes, it
blocks the ducts.
Blocks the ducts right there. Stress is a major player in this game as well, because when mothers are stressed, they don't have a letdown. They don't let down as freely as they usually would. And when that happens, they get a blocked duct as well, and then leads on to mastitis sometimes. There are other reasons why mastitis happens as well, but a lot of it sometimes is related to stress levels, not sleeping enough, knowing that they're going to be separated from their beautiful babies in a couple of weeks, months.
Oh, like a
days.
Return to work kind of stress.
Yes,
I can imagine.
So we think about it as a microbiome. So I often refer to my patients with to have a good microbiome in the gut relates to a good microbiome in the breast, because it's living cells, it's a living culture as well. So having a good microbiome in the breast usually just tells us that it delays mastitis sometimes. Yeah, it's up and coming. It's new research that we haven't quite put our heads around yet.
PWRMUMS exclusive.
Yes.
Well, it makes sense, right? Like and so what you eat is also what you produce. Yes. A good healthy diet produces. In theory,
but you could still make amazing breast milk just by having McDonald's every day.
What?
Yes.
This changes things for me. You'd probably have like rich, thick breast milk from. Wouldn't be that watery stuff.
No, actually. Well, we'll come back to that. Hang on. Remind me about that. Okay, so breast milk is made in spite of what the mother eats. Okay. So the nutrients come from the mother's reserves. So the calcium will get leached out of the bones, the proteins get leached out of the muscles, the vitamins and minerals will just come, whatever can be taken out of the milk, it just sucks it all. It sucks the mothers dry, really.
We've had this conversation before in the iron one, how babies suck iron from the mums as well.
Yes, babies do.
So they take what they need despite what we're eating.
Exactly.
So then it's just in our interest to eat well, because then we're going to replenish what they're
sucked out of you.
Okay, good to know.
Yes, and it's also really important for baby number 2.
Yeah? Why did you do that to me?
Well,
you never know.
You make beautiful babies, Catherine.
Oh, thanks. My baby is frequently seen in Doctor. She's always done something or got something up with her.
I love her.
Just come and hang out.
Yeah.
Okay, so with baby number 2, it's important.
Yes, and also for mother's general health as well. Right, so there's a study that explains how babies actually do take calcium out of the bones of the mother, but because if a mother has a good diet, a good varied diet filled with calcium, the calcium just gets sucked back into her bones again.
Okay. So the mom's like, nah.
We're going to suck it all back. Yes, there you go. So that's why it's also very important to have a varied diet.
Yeah. Okay. Yeah. And then you said remind you to talk about this thin milk.
Yes, the thing. So breast milk has a very good amount of fat on its own, but that fat is sometimes not even necessary.
Oh.
So yes, we have creamier breast milk towards the end of the feeds.
Yes.
But you know, we live in Singapore. There isn't really much of a need for so much of fat if you think about it. So yes, if you had a mother who lived in Alaska,
she needed that extra padding.
Yes, she needs that extra blubber compared to a child in Singapore.
Yeah.
Right?
Oh, okay.
Yeah.
So that thin milk that you get is perfectly fine, because I think this is something, I'm in a few mums groups, and this is something that gets talked about quite a lot.
Yes.
Is, oh, my fore milk or my hind milk. Oh, my baby's sick because my baby's gassy because it's getting too much fore milk. Is that a myth?
Yes.
Oh, I'm guilty of spreading these.
There's no clear-cut definition of when fore milk ends and when hind milk starts, right? It's really just a continuum. So I often liken breastfeed at the breast as having the appetizer, the main course, and the dessert. So the appetizers would be like your, you know, a little bit of burrata cheese and your tomatoes.
Nice.
And then your main course could be, you know, your fish or your chicken. That's a good amount of, you know, dense foods, right? And at the end of the meal, you have your rich, creamy, melting chocolate lava cake. Divine. Anyway, but that's what, see, so
I love that analogy.
so that's a continuum that we're talking about. So what we find that mothers are very concerned about their fore milk, it doesn't really fit into this picture unless the mother is pumping and expressing breast milk.
Okay.
Yeah, so, you know, we talk about breast pumps, we talk about the haka and the equivalents, and of course, baby being fed at the breast is definitely a lot better. But if you have a mom who needs to be able to express breast milk, you'd really need to invest in a good double electric breast pump, and not just a haka.
Not just a haka.
Not just a haka.
And is the haka good for if you're feeding? I can't do it anymore because she wriggles too much. But if you're feeding off one breast, when she was small, I could haka the other side. Is that when the haka is useful?
So the haka is good if you really just need to get a little bit of breast milk to make, you know, porridge or cereal.
Okay.
Because it's not an effective breast pump.
Yeah.
It's not stimulating the breast. It's not working on the glands to actually squeeze the muscles out and get the milk out of the breast. It's really just a letdown collector.
Okay.
So not an ideal way of removing breast milk from the breast at all.
Okay. But a double electric breast pump would be. Yeah.
Yes.
Which is the best one? I have a Spectra. I like my Spectra.
Spectras are great.
It's
There are
alright,
lots of others as well. There's the Omega, there's Medela. But these are the ones. So I often recommend that moms get a good quality double electric breast pump and use the money for that.
Yes.
Yeah. And not the others, because the others are just not good enough. The suction quality is not good enough. The pump parts are not good enough, and they just don't last. You know, they don't have that kind of a rigorous testing that these known brands actually come with.
It's like a mattress. It's worth investing in a good one because you're going to be using it. If you're going to be using it a lot, then you want it to
or
work.
a car.
Or a car. Yeah.
Yes.
Okay. And so what about? Oh, this is something that gets me. In the US, they can claim a breast pump on their insurance.
Yes, I know.
But here you can't.
No, you can't.
That would be good, wouldn't it?
It would be lovely. But you think about the amount of money that you save. Instead of feeding a baby with formula, but actually getting a good quality breast pump, that's a lot of money saved already.
Yeah.
If you think about it, how much does the Spectra cost? About $300 or $400?
I think so.
That's about...
Bit less on Popsick.
Ah, there you go. That would be about 8 weeks of formula, I would say.
Yeah.
Yeah.
Yeah, definitely. And some people do have to pump exclusively, and that I feel deserves a medal. Absolutely.
That's hard work. I mean, I struggled to pump throughout my how many years of breastfeeding?
Many. She's still breastfeeding.
No. They're back to me. They're owned by me again. But yeah, no, it's gosh, hang on. I need to do the math. I think it was 8 years of breastfeeding that I...
In the last 10 years?
In the last 10 years, yes.
Yeah, that's a lot.
That's, 8 years of breastfeeding.
Wow.
So I struggled to pump, and pumping was not my favorite activity.
No, I'm with you. Yeah. So did you just pump enough while you were, like if you had to go to work or something, you would leave a bottle?
Absolutely.
And then you would latch whenever you could?
Yes. So, and that's what we recommend to mothers as well. You know, pump only when you are planning a separation.
Yeah. It gets quite stressful, the pumping. I pumped before work and I was getting so stressed about it. Of course, that wouldn't have been helping my supply.
Yes.
And then I bought a tub of formula and I just put it in my drawer. And as soon as that tub was there, I wasn't stressed anymore because I knew there was food there if she needed it.
If she needed it.
And then it seemed to help a little bit.
Yeah.
So it's funny. I think it's very mental and stress related for sure.
Absolutely. So we often tell moms to get distracted. Don't look at the bottle when you're pumping because that just turns it all off.
I stare like this. My husband's like, you can't do anything else. And I'm literally there like this. I hold it on and I stare.
It turns it off.
Yeah, because then if I do get distracted, especially by the baby, I look down, I'm like, oh, lots is coming out.
Yes. So Netflix is great for a distraction.
Top tip, don't look at the breast. Make sure it's on right, and then don't look at it.
Yeah, just don't look at it until the 20 minutes is over.
Yeah. I do also feel like some people's breasts are made for pumping and some people's breasts are made for breastfeeding, because mine, I feel, are not made for everyone probably feels this way. I feel like it's a real manual, like I feel like I have to really work at it to get a bottle.
Yeah.
Whereas I know that if my baby didn't latch, I wouldn't be able to exclusively pump. It would drive me absolutely crazy.
I don't know about that.
No,
it's a learned skill.
Yeah.
It's a learned skill. It's like learning a dance, just like breastfeeding. You just have to keep practicing to get it. Yeah.
I hate it.
I know. You're not alone.
No.
You're not alone.
And so did you ever have any issues with breastfeeding yourself?
So yes, I've had quite a few bouts of mastitis. Not pretty and not fun. And a lot of the times mastitis came off just before I had to go back to work. Then I had problems tandem feeding. So I've got 3 kids, and so I had to tandem feed at least for 2 years or so. Yeah, so I'd had the older one on one side and I have the baby on the other, and there's always a lot of pushing and shoving at the breast. I'm like, stop it and knock it off. Leave.
Get off, bra on. Mommy's closed.
Yes, the milk bar's done.
The milk bar's done. Oh, that must have been a real challenge.
Yeah, it was interesting, but at the end of it all, you see that the 2 babies, the 2 kids really just get a lot closer. You could see them playing with their fingers and holding hands at the breast. It was really quite
that's
sweet.
quite touching.
Yeah, and I think that's one of the best ways to get the older child to get used to the new baby as well.
Yeah, absolutely. Yeah. And so with tandem feeding then, so how long did you breastfeed each child for?
So because I've had my kids so close in age, and because of my extended breastfeeding, I think I fed, so my first one, I shouldn't be saying this, but he fed for 5 years.
Yeah?
Yeah.
But obviously not like, that wasn't his main source of food by the end. It was a comfort thing, right?
It was a comfort thing, and it was like a panacea. He falls down, he comes to me. He gets upset because his sister took his toy. He'll come back to me, and it just solved a lot of issues. And so. What was your question again?
How long did you breastfeed them for?
All right, so Keisha was breastfed for 5 years. Nikita was breastfed for 4 and a bit. And Sham was breastfed for about 3, almost 4 years. Yeah.
And did they kind of self-wean towards the end?
Yes.
Or did you have to save milk bottles?
Well, I had to coax my daughter to stop because it was just getting a bit much for me. And so we had a lot of conversations about this, and funnily enough, when I told her to wean off, that's when I had a possible milk strike from the youngest.
And then you're like, come back!
Come back! I need you,
come back! Milk bar's reopened.
Only for you though. Exclusively.
She had a milk strike.
So there are quite a few upheavals in the game.
Yeah, I can imagine. What's a milk strike look like?
A milk strike. It's when your child decides that he or she is done.
Okay.
And oftentimes, if it happens before 11 or 12 months, it's just a period, a short, strike really, to say, no, I'm done. But they usually get back onto the breast again. It's usually when it happens at about 1 or 2 years old, when they have a little bit more understanding about, the emotions that come along with breastfeeding. That's when it may get a little bit harder to coax them back to the breast.
Yeah.
And so that's what happened. Yes.
But you got through it.
I had to. I basically sent everyone else back away, like packed their bags and sent them away for a couple of days.
Yeah.
And I just spent time with the youngest. And I had the milk bar open all the time.
Yeah, that's what you got to do.
Yes.
I found that when my baby was poorly a few weeks ago, I just nursed her lots more than usual. It was definitely for comfort, and that also seemed to re-stimulate my milk as well.
Absolutely.
Just having that kind of skin on skin again that you do when you're way back as a new mum. I did that quite a bit, but 8 months on I wasn't really doing that much, and it was really lovely.
Yes,
it was really kind of a bonding
it's
experience.
really just a hug.
Yeah,
it's just how babies like to be hugged, with as much skin contact as possible,
and a drink
and drink. Yes,
who doesn't like snacks?
Yes.
That's great. And so also when you do have mastitis or when you do have a blocked duct, you've got some good tips for how to get rid of such things, don't you?
Just feed your baby.
Yeah, no, but the upside down the upside down Spider-Man kiss.
Is that the dangle feeding? Is that the one? Yeah. So yes, dangle feeding is great.
Yeah, that was what worked for me amazingly.
Dangle feeding just helps you open up everything. It opens up all the ducts, it gets the milk flowing again, and gravity assists, of course, because you're just dangling on all fours over your baby.
Yeah, I was going to say, for those that don't know, you're on all fours and you're dangling and you're letting your baby drink from you being kind of upside down.
Yes.
And it works.
It works.
Yeah. And sometimes do people have to take, I've heard sunflower
lecithin.
Is that something that helps some people?
So we don't really know why moms get blocked ducts. Some mothers are more prone to blocked ducts, and and it's got to do with the amount of fat. So the omega-3 to the omega-6 ratios. Perhaps it's just eating too much outside food rather than cooking the food at home. Maybe it's too much fatty fish. I don't know. We don't know. The studies are not very conclusive yet. But so sunflower lecithin, what it does is it breaks down the fat molecules into tinier, more palatable molecules, I suppose. And so it's just easier for it to flow right through the breast ducts.
Ah, okay. Because I've had some mums that say they have to take it else they will get mastitis. They're really that convinced about it.
Yes.
Yeah.
It might be due to the inflammatory states of the mothers already. Yeah. So
And what are some other things? Ultrasound? Do you believe in ultrasound for
blocked
ducts?
It does. Yeah. So I think it works for bruises as well, doesn't it?
It can do it. It depends on what settings you do. So you have to. The problem I think with ultrasound from a physio point of view is that sometimes physios aren't that specific with the dosage.
Oh, right.
So if you're just throwing a bit of ultrasound on, it's probably not going to do anything. Whereas if you calculate an appropriate dosage and a depth, and the frequency and the wavelength and things, you can be a bit more targeted and specific. Okay. So I think ultrasound for blocked ducts, for me, it seemed to work.
Yes.
And I've known other people that swear by it. So
look, in the same way, I would say a vibrator or an electric toothbrush might do the same trick.
Okay.
Just by loosening it up a little bit, right? So I tend to just use my hands and just shake it out a little bit sometimes. Yeah. Okay.
Just
milkshake.
Milkshake. That's it. It is a milkshake.
It is a milkshake. Yeah. Just I don't know. Maybe it helps to emulsify the fats. I don't know, but it works. It does loosen the milk ducts a little bit.
Yeah. And then what about mums that come to you as a new mum that are saying, my baby can't latch, my baby's got a tongue tie, my baby's got this, my baby's got that, I'm stressed, help me. Is that quite a common?
Yes. Yeah. And a lot of times the tongue ties tend to be the bad guys, but if you think about it, okay, in the olden days, what had happened was the midwives would just use their long fingernails and just, put it under the baby's tongue and snip off whatever might have been attached, a tether in the tongue, right, at the bottom of the jaw. So if a baby has a very severe tongue tie, there's no other way to get around it but to actually do a snip. And most of the time it's either with the scissors or with laser. But if it's a mild tongue tie, the mother's anatomy, the breast anatomy is perfect. And we can actually, what we often do is then we adjust the position such that the baby's then going to be able to have a better, bigger mouthful of breast tissue. Right. And that might just help him along. Okay, so that can be a really simple thing of you saying, just hold them like this. Yes. And then it saves the baby having a procedure. Yes. Because having a small tongue tie doesn't affect you as an adult. Does it? Or it could. I'm trying to think. I'm trying to talk how it might affect. Yeah, it sounds like a lisp. Okay. It may affect the speech of the baby. Okay. Yeah. But that could always be fixed later on down the road if it did become a problem. If it is really a problem. Yeah. Then yes, it can be fixed. I'm sure I've got people who have been knocking on my doors and saying this is probably not the best idea. All tongue ties need to be fixed. Yeah. But that's how I practice. Mm-hmm. Yeah. And I suppose if you go looking for these things, you'll find them. You'll find them. Yeah. Do they look for it in other countries? Is it talked about as much? I believe it
in
is.
all countries.
Yeah, I believe it is. Maybe Singapore has just become westernized too quickly, that we have lost a lot of that midwife snipping the tongue tie thing.
Yeah.
Maybe
Probably I know why, because midwives aren't allowed long nails anymore.
Yes.
You'd have to have your nails really short.
And it's all hospital births, which means that they are then governed by the rules and the regulations of the hospitals and not just their own rules.
Yeah.
You know, midwives used to just go out to the houses and deliver the babies just then and then, right?
Yeah,
it's changed.
It has all changed. And do most women benefit from seeing a lactation consultant?
A lactation consultant would be someone you see. It's like a GP practice, right?
Okay.
So you come and see a lactation consultant, or you get the help of a lactation consultant if you have problems. So it's a dance, right? Both mother and the baby are participants in the dance. You need two hands to clap, right? So really what you need is a mother who's able to get the milk supply, and a baby who's going to be removing the milk supply from the breast. And if either one of these partners are not quite getting it right, then we have issues, and that's when we might be able to help.
Okay.
Of course, there's also the environment and the social net settings and all of that. It has a huge role to play. Like if you had a really supportive partner, then mothers tend to have a much easier time of it.
Really?
Of course.
Because it's just that it's all a bit more relaxing.
Yes.
And do you have some women that all you have to do is reassure them that they're doing fine?
Oh yeah.
Is that most of all?
Yes, that's the most important.
Yeah.
And I think a lot of moms just really need to know that they're doing a really good job for their babies, and they're doing whatever they can for their babies, right? And I think that's the most reassuring thing. That's the best thing mothers really just need to hear. Mama guilt is real, isn't it? Mama guilt is so real. I still have mama guilt. I think my mama still has mama guilt.
And we just put it on ourselves.
Absolutely.
And we would reassure our friends, right? We'd be like, you're doing amazing, why are you stressed? While secretly carrying our own burden of stress and guilt.
Absolutely.
Yeah.